Welcome to Primal Air. My name is Shirley Gutkowski. I'm the owner and founder and lead practitioner and multiple hat wearing person. You may have read my articles in different journals. You may have been in my audiences across the country, and you may or may not know me. In 2014, I took my first myofunctional therapy course, and I was completely hooked. I've been trained and certified through the AOMT group. I've taken an introductory course with Kimberly Bankert, and I've taken many courses along the lines with, well, maybe lectures is more accurate. Dr. Gavalis in the Chicago area, Dr. Boyd in the Chicago area, Dr. Zagi. I'm in currently, this is November, almost the end of, it is the end of November. It's almost December of 2025. I am in cohort number 6 with Myo Masterminds with the Breathe Institute. And this has been a passion of mine for quite some time. Also, a passion of mine is the primal lens and looking at health through a primal lens and going backwards in order for us to move forwards. And one of the things that I've wanted to produce in the last 10 years since I've started Primal Air was an online course for people who have, like 5 kids that all need tongue tie releases, or pediatric dental offices where many, many, many children are stuck behind a paid curtain where they can't afford myofunctional therapy before or after tongue tie release. And so it just doesn't get done. And then the dentist is stuck either not doing anything or doing a release and just hoping for the best and hoping for some kind of an improvement. So, in an effort to solve that problem, I have come on to, and I finally have enough help to get it finished, an online prehabilitation and rehabilitation course. So, the course is designed to be self-directed. Patients will have 2 weeks of myofunctional exercises before they go on to another 2 weeks of myofunctional exercises and then a third 2 weeks. So there'll be 6 weeks before the beginning and the end of the rehabilitation stage. If they follow the directions well, and I've made it pretty easy, and obviously you can give me a call anytime to get yourself aligned even tighter with what we're doing. And then they'll meet with me in person online for a half an hour about a week before the release. So between you, the doctor, and me, the therapist, the asynchronous therapist, will figure out if they are ready for the release. And I'm pretty confident that that'll happen. So you'll do the release. I'll meet with the patient that day just to see how things went. You'll send me a 1-page report with a photo. Did you do stitches? Was the patient, coherent? Were they ready? Did you have to go deeper than you thought? You couldn't go deeper. There was too much bleeding. Just a little report on what it was that happened during the appointment. And then a week later, I will give them more strenuous exercises. So we'll be in touch with the patient to give them the exercises that they need to know before rather with stitches or without. So there is going to be a difference there, and I can work with all. It's not that I can work with them, but obviously I can work with them, but our system is set up so that your patients will have good access to information with or without stitches. So with this model, you will let us know what your interest is, and we will give you a code for your patients to log in to our system to get a 50% price reduction. So currently, that would be about $800 for the complete system with the asynchronous coaching. At any point in time, they will have an opportunity to ask for an in-person appointment, and that will be an extra fee then. So they'll still be able to get in-person stuff, but there'll be an in-person fee for that. So using your code, they'll have 50% off. Your you, the doctor, will have already diagnosed them with the tongue tie. What happens without this model is many times patients will come to us out of nowhere and they will still need to be diagnosed with a tongue tie. For us, it's a findings, and then they have to be sent off to a savvy tongue tie release practitioner who will do the actual diagnosis and surgery. Once the diagnosis is made, and if they're your patients, that's obviously already been made, they can go online, they can access the portal and follow my instructions per exercise. So if they have to do finger bite pops, for instance, okay, I have one video per exercise, and then I have a video for them to follow all the exercises together. And that helps them see that they can really get all of the exercises done in about 10 minutes. We'll be asking them to do 3 times a day. The final 2-week session will be 5 times a day. And then they will be prehabilitated and ready for a functional release. If not, then we'll have to deal with that as we go on. And then they will be able to follow the exercises along as they rehabilitate afterwards as well. They will be asked to send in photos and or videos of the postures and maneuvers on occasion, and they will be seen, as I mentioned, three official times in that fee. The fee will also cover a kit, and the kit will be our Primal Air branded kit of tools. They'll get Stella Life Gel, they'll get cotton rolls, they'll get the linguistic so that they can stretch everything that needs to be stretched. They'll have, I don't know, whatever all we put in there, pencil and some other things that they're going to need for the rehabilitation. So that's what we're planning on doing. You, the doctor, will be in charge of everything. If you have questions or comments, you can do that through primalair.com, or you can just give me a call. Our number is 608-318-2800. So I'm not going to be promoting this to consumers. I'm trying to go all the way through the doctors. If you have a way of doing this a little bit differently, this is very much in the early stages. All the videos are cut, they're all uploaded. We're just, machining out just a couple of more things. Should be ready before January 1st and potentially even December 15th of 25. So I hope that this is going to satisfy some of the problems that we were having with getting our services out to more and more people. As the diet continues to improve, we're still going to be having a lot of cases with tongue ties. And the earlier we can get these tongue tie releases done, the shorter treatment time these people are going to have when they're adults. So let me know one way or another what you think, how you'd prefer for this to look. If you'd like to do it a different way, I can certainly talk with you about how that can work. And so that's the outline. That's the service that we're going to be providing and the problem that we hope to solve. My name is Shirley Gutkowski. I'm the owner of Primal Air. I'm the primary therapist, and we're so excited to be bringing this kind of technology to your patients, to your practice without, being in your practice. Have a great rest of your day. Thank you so much, and let me know what you think.